you like a needle in your face? Of course you would. Now, would you like a needle in your face if it would erase wrinkles, make you look younger, and didn't cost that much? Got your attention now. Dr. Timothy Greco is a Valley Kenwood plastic surgeon specializing in the face, head, and neck. He was voted top plastic surgeon by his colleagues in Philadelphia Magazine this year. And then along came Penny. Penny is from South Jersey. She's a professional working mother who wanted to look younger. She got Botox for her frown lines and crow's feet. As a matter of fact, we happen to have pictures before and after Penny got that. Did it hurt, Penny?
No, not at all.
Didn't hurt? Okay.
No.
So there's the before and after, and this is the Penny. The pictures that we're looking at took how long between the before and after?
About 4 weeks, I think.
Okay.
I don't remember exactly, but I think it was about 3 or 4 weeks.
Okay, doctor, how many shots of what we just saw for Penny? How many shots?
Sure. There were 5 small injections in the frown line area, and there were 3 injections on each side for the crow's feet area.
Okay. Who's a candidate for this? Anybody that's got a frown line, wrinkles, anything?
Sure. Really, the candidate is a patient that is bothered by their wrinkle. The nice thing about Botox is that it's a simple in-office procedure that can allow a patient not to have any downtime. And also it makes them feel better about themselves when they look in the mirror, that the person looking back feels the same way they do inside.
Why did you have it, Penny?
Because I began to be concerned about the lines on my face because of what I do professionally.
What do you do?
I'm president of a marketing firm, so basically I do sales.
Okay.
And I had read about the procedure, and I had researched the different physicians in the area that administer this procedure. Okay. And it seemed to be really perfectly safe. Part of me was curious. So I spoke to some people who knew people who had had the procedure, so I went ahead and did it.
Okay. And doctor, we're going to roll a tape now of the shots themselves. And okay, this is, okay, here we go. Oh boy. The needle, it's just a little pinprick.
Very small needle.
And it is in the skin for how long?
Actually, it's a very quick injection.
It is.
The injection goes below the level of the skin into the muscle.
Okay, we see this. What's this little yellow thing traveling along the inside of the skin? What is
Actually, what they're showing you, what the tape is showing you here, is the mechanism of action for the medication. What Botox does is prevents the neurotransmitter from being released at the nerve terminal, so the muscle relaxes. And that process happens relatively quickly, within 3 to 5 days, and the effect of Botox lasts anywhere between 3 to 6 months.
Now, if you take the word Botox, the second part of the word is tox, as in toxin.
That's correct.
As in poison?
That's right. Botulinum toxin is produced by a bacteria, Clostridium botulinum, but it's a purified protein that is used in the administration for facial wrinkles, and has a very, very safe profile. It's been used for over 10 years for wrinkles and other things, particularly strabismus and for spasm around the eye, but it has an incredibly safe profile, and it's been used in hundreds of thousands of patients safely.
Make any difference what color your skin is?
No, actually...
Light skin, dark skin, anything?
That's a very good question, Wally. Thin-skinned patients, I find, get a little bit of a better result. Thicker-skinned patients can get a nice result from Botox, too, but it's more dramatic in patients that have thinner skin with the finer wrinkles, because the muscle is right underneath the skin, so the...
How do you know if you're thin-skinned or thick-skinned?
The surgeon or the physician that's looking at the patient can determine that.
Okay, we'll take a break. We'll come back. We'll meet another patient, a little bit younger than Penny, but who need a little more Botox in a minute. Stay tuned, and we'll get some more answers to your questions. We'll find out, most importantly, how much does it cost? Don't go away.